Chantel against Cameron at WAJR.com.
This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
And good morning. Welcome into the program. I'm Dave Wilson. Our guest this morning is Jennifer Rowan, Director of Revenue Cycle for Mon Health System. We're going to be talking about Medicare Open Enrollment. First, say good morning to Jennifer. Jennifer, good morning.
Good morning. How are you?
I am great. I appreciate you taking some time. We'll jump into the subject here in just a moment. But first, even you, Jennifer, must talk about you for a little bit. That's the way the show goes. So just tell us a little bit about your background, where you went to school, and how you ended up with Mon Health.
I've been in revenue cycle, which is, it consists of pre-access or pre-registration through admissions, coding, billing, collections, even our revenue integrity for almost 24 years now. I went to school, University High School here in Morgantown. I've been in the Morgantown. I grew up in Brewster Mills, West Virginia, but I've been in the Morgantown area for over 20 years now. I also went to Fairmont State University and WVU for some college.
It says something about, and I talk to people, obviously, each and every week with the Mon Health System, and I hear this a lot, Jennifer, folks who have been with Mon Health System for 15 years, 20 years, 30 years, 40 years. You just go down the list. And that really kind of speaks to the environment and the type of a place it is to work when you've stuck around for 20-some years.
Yes, Mon's the best. Our culture, Mon truly is a family atmosphere. The practice of our providers who keep striving to do more than the competing services. Patient experience, even myself personally and even my family. We've also had many patient responses of the quality of the service that the team provides. They make them feel at home. There's not many places that you can go and receive the top performing services that Mon provides and still get the feeling of being the difference. And our nursing team helps, patients stay calm when, a lot of times you're going in and you have that anxiety. We have had such great response of just the feeling that the patients receive not only from their care, but as if they have someone right there at home.
Did you set out, when you were looking, starting your career, did you want to get into the healthcare field, or did it just kind of happen and then you found the home there?
No, truth be told, I wanted to be a marine biologist.
Okay.
That definitely took a different turn. I just started out there whenever I was going to college as a student assistant and started working with our billing team and collections team, and it just kind of grew on me, and I just stuck with it and developed from there.
Jennifer Rowan is joining us this morning, Director of Revenue Cycle for Mon Health System. Okay, Medicare Open Enrollment. Tomorrow is the start of the Medicare Open Enrollment period. Let's start here. What is that? Let's start with that question.
Medicare Open Enrollment is the period where those who are eligible for Medicare can take the time to review all of the options, compare what plans are out there, and even allow you to make changes to your coverage.
So who will this impact?
Everyone who is eligible for Medicare. This is important because as plans change each year, it's important to review those options for what coverage for your medical needs are. For example, if you're paying a Medicare Advantage plan with lots of benefits, but you're not using all of those, you may find a plan that has more basic benefits at a lower cost for you.
Can you explain, and we can paint with some broad brushes here because I know everybody's situation is a little bit different, but generally speaking, who's eligible for Medicare?
Those 64 and older.
Okay. So patients who, in that bracket need to be aware of this open enrollment period. So why do they need to be, or why do you need to be aware and need to be, kind of on top of this, Jennifer?
You want to make sure that you're aware of what those benefits coverages are, there are plans that are out of network. So and those who may have a plan that is out of network could end up with a higher deductible and out-of-pocket limits. Although we do have a team that, consists of going over each of those plans, and if they are identified as out of network and work on payment options, it's best to use this time to review and understand what your coverage is.
Talking to Jennifer Rowan, Director of Revenue Cycle for Mon Health System. What does it mean for a patient if they do not have Mon Health in their network?
That they could have a higher out-of-pocket cost or no coverage with Mon Health. So it's very important to, look at all of the options side by side. We have team members on site that can help explain those options as well.
Talking to Jennifer Rowan, Director of Revenue Cycle for Mon Health System. We'll continue the conversation. We're talking about the Medicare Open Enrollment period, which begins tomorrow. We'll continue the conversation on the other side of this timeout. More Mon Health Talk in a moment on the Voice of Morgantown, WAJR.
Shop the Sherwin-Williams Fall Sale and get 30% off paints and stains from October 11th through the 21st. With prices starting at $34.29, it's the perfect time to transform your space with color. Whether you're looking to revamp your bedroom, living room, or home office, we have you covered with bold hues, soothing neutrals, and everything in between. Shop the sale online or visit your neighborhood Sherwin-Williams store. Retail sales only. Some exclusions apply. See store for details.
Monongalia County, Jason Morgan has served you for decades. A lifelong resident, U.S. Army veteran, and dedicated first responder. For 15 years, Jason protected our community as deputy sheriff. Now he's running for sheriff of Monongalia County.
I'm committed to serving this community with transparency and hands-on leadership.
Vote Jason Morgan for sheriff. Expect excellence.
I'm Jason Morgan. I'm your Republican candidate for sheriff of Monongalia County, and I approve this message.
Paid for by Jason Morgan for sheriff.
The families of those facing dementia often have many questions about handling the medical care and legal needs of their loved one. At the Seaman Law offices, we focus in elder law and the issues that accompany these challenges, helping families prepare the documents they need to plan ahead. Call the Seaman Law offices today and let's talk about your situation. The Seaman Law offices, 304-554-2900.
Seaman Law. Americans love using their credit cards, the most secure and hassle-free way to pay. But D.C. politicians want to change that with the Durbin-Marshall credit card bill. This bill lets corporate megastores pick how your credit card is processed, allowing them to use untested payment networks that jeopardize your data security and rewards. Corporate megastores will make more money, and you pay the price. Tell Congress to guard your card, because Americans lose when politicians choose. Learn more at guardyourcard.com. Paid for by the Electronic Payments Coalition.
So this new dose is, nope, that's not it. The price is nowhere to be found.
Mr. Green? Hi, it's all good. We've got this.
This is not just help from a Walgreens pharmacist.
Oh, new prescriptions. Cool. Let me check to see if these are the lowest cost options covered by your Medicare plan.
Oh, that's great. Thank you.
This is someone supporting you every step of the way. Chat with a pharmacist today to find help saving. This is the human kind of help. Walgreens.
In business, service is everything. Cintas delivers what you need to better serve your customers. Whether it's freshly laundered work apparel for almost any job imaginable, tested and inspected fire protection systems, first aid and safety supplies, on-site AED training, or mops and restroom products, stocked and ready when you need them. Better work days happen together. So visit Cintas.com.
Oh, I'm ready!
And get ready for the workday.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning is Jennifer Rowan, Director of Revenue Cycle for Mon Health System. We're talking about the Medicare Open Enrollment period, which begins tomorrow. And I got to be honest, Jennifer, there's part of me that dreads this time of year. You get to fall, the leaves change, and football season, and then you go, oh, man, we got to review our health insurance policies again for the year. So, and it gets confusing. You start, comparing plans and deductibles and copays, and it gets, you can get into the weeds very quickly. So for patients who don't fully understand the process. Billing and financing can all be very confusing. What can they do? How can you help, or how can Mon Health help, or where can they find help?
So we do have a customer service line that patients can always call in for any kind of questions. However, we do also have staff at each of our hospitals that are on site that are happy to sit down and review and discuss any questions that you might have about billing, finance, and even can route with, the topics of your insurance plans and the coverages for all of your plans. So you're not there.
Go ahead.
Oh, sorry, go ahead.
No, I was just curious, what are some of the common questions or concerns that you typically hear a lot as, we enter this time period every year?
Just truly, we hear, why do I need to choose a plan? What is the best plan for me? What is my out-of-pocket expense going to be? What does that mean to me? Would you like to be able to, although, CMS.gov might say, here's where you can review all of your Medicare plans, but to have somebody sit down and explain what each of those plans mean to a patient beyond just reading something online is what we're here for. But we do get a lot of just truly understanding what a deductible means, what a co-insurance means. Deductibles are your annual fee that once you satisfy for the year, it'll start over again the following year. We mentioned some of the Advantage plans. Again, if it's important to understand if they're in-network, that'll pay at a higher rate versus out-of-network and could leave you, which is balanced. We can bill those to the number. And a lot of patients don't understand that if they have Medicare or Medicare Advantage, that their coverage plans can, in fact, change and could leave you with a higher out-of-pocket.
What are some factors or variables you need to consider while choosing a plan?
What are your medical needs? Do you have a lot of frequent visits to your provider that you would want to choose a higher Advantage plan and drug plan? If you're not frequently, don't have high risk medical needs, maybe a basic plan for a lower cost is more important for you.
And obviously, I was going to say this goes without saying, but I'm going to say it anyway. That changes over time when your medical needs as a young 30-something-year-old versus when you get into your 40s and 50s. Are you starting a family? Do you have older children? All of that changes. It changes drastically, Jennifer, over the course of your lifetime, obviously.
Yes, and it changes every year. So every time that there's an enrollment period, it is important to use that time, understanding what your needs are, to be choosing the right plan for you.
I don't mean to boil this down to, because it is very important, and it is obviously can be very complicated, and that's what you all are there for. But the bottom line is you want to make certain that you can get the care you need. Isn't that the bottom line?
Yes.
Talking to Jennifer Rowan this morning. She is the Director of Revenue Cycle for Mon Health System. We'll take our final break. We'll continue the conversation in just a moment. You're listening to Mon Health Talk on the voice of Morgantown, WAJR.
Here's another WAJR Community Calendar update brought to you by Freedom Kia in Morgantown. Head to Chestnut Ridge Church on October 19th for a night of whimsy and candy. Candy Quest is a family-friendly event for children of all ages to enjoy. Wear your best costume and embark on a quest to find sweet treasures that lie around every corner. The Taylor County Monster Maze is October 20th. Navigate your way through a maze of prizes, collect candy, and take part in other Halloween activities. This event is catered towards kids in preschool and kindergarten, but of course, adults and older kids will enjoy this maze too. So dress the part and put on your spookiest costume. You can check the community calendar or submit your own nonprofit event or fundraiser anytime at wajr.com. This update is brought to you by Freedom Kia in Morgantown. Freedom Kia brings you a transparent buying process with no surprise markups or must-purchase accessory packages. Just a fair price on Kia's entire lineup. Experience the Freedom Kia in Morgantown difference.
Hi, Toppy Kercheval Talk Line on Metro News. Every Friday on Talk Line, it's Steam Release.
Our state is not recognizing the value of child care providers. And who were the ones that were there on the front line when our state was shut down for a pandemic. Those child care providers were the first ones there to make sure that our children had a safe place to stay every day. And we need to have those child care providers and our families supported.
Steam Release every Friday on Talkline right here on this Metro News radio station.
When you're hiring for your business, ZipRecruiter's powerful matching technology makes finding qualified candidates for your job easy. This made us wonder, what if the rest of the world was as easy as ZipRecruiter? Math problems wouldn't be so problematic.
K equals 42.
Escape rooms? Elementary. And summiting Everest would be a walk in the park. In the meantime, if you want to make your hiring easier, use ZipRecruiter. And right now you can try it for free at ZipRecruiter.com/free. In fact, 4 out of 5 employers who post on ZipRecruiter get a quality candidate within the first day. Simple. So, see what the world is like when ZipRecruiter does the hard work of hiring for you. Just go to ZipRecruiter.com/free to try ZipRecruiter for free. Once again, that's ZipRecruiter.com/free. ZipRecruiter.com/free.
We are coming down the stretch of this high school football season, Week 8. Coming up, High School Sportsline will begin the week's coverage at 7:06 on Wednesday night. Then play-by-play Friday night of University, winners of 2 in a row. The Hawks will be at Spring Mills. Coverage following an abbreviated Sportsline, play-by-play at 7, then game night until midnight. We'll stream Morgantown High at Parkersburg South. Clay Battelle against Cameron at WAJR.com.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Our guest this morning is Jennifer Rowan, Director of Revenue Cycle for Mon Health System. We're talking about the Medicare Open Enrollment period, which begins tomorrow. Jennifer, how long is the open enrollment period?
Through December. Oh, sorry.
Oh, go ahead. It starts tomorrow and runs through when? Jennifer? I think we lost you. Are you there?
Okay, sorry. Sorry about that. I had a break in coverage there.
Oh, no problem. No problem. We got you back. We got you back. So open enrollment begins tomorrow, and it runs through when?
December 6th.
And how do folks go about? I mean, do you go online to make these selections these days? Can you go see an actual person and make these selections? How do you actually make the selections and make sure you're enrolled?
Yes, go online, or you can sit down with an advisor to go through these selections and to help you make the right decisions.
How can we do we need to make an appointment with an advisor, or who do we contact?
Contact.
Oh, we definitely lost her that time. I heard the click and pop. Well, it happens. We'll try to get Jennifer back on the line. Well, if you've ever been driving across Montague County, you know the cell phone coverage. It happens. It's okay. We're going to try to get Jennifer back on the line and get you that information so you can make an appointment. Tell you what we will do in the meantime. We'll take a quick break.
Against Cameron at WAJR.com.
This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
And good morning. Welcome into the program. I'm Dave Wilson. Our guest this morning is Jennifer Rowan, Director of Revenue Cycle for Mon Health System. We're going to be talking about Medicare Open Enrollment. First, say good morning to Jennifer. Jennifer, good morning.
Good morning. How are you?
I am great. I appreciate you taking some time. We'll jump into the subject here in just a moment. But first, even you, Jennifer, must talk about you for a little bit. That's the way the show goes. So just tell us a little bit about your background, where you went to school, and how you ended up with Mon Health.
I've been in Revenue Cycle, which is, it consists of pre-access, our pre-registration, through admissions, coding, billing, collections, even our revenue integrity for almost 24 years now. I went to school, University High School here in Morgantown. I've been in the Morgantown. I grew up in Brewster Mills, West Virginia, but I've been in the Morgantown area for over 20 years now. I also went to Fairmont State University and WVU for some college.
It says something about, and I talk to people, obviously, each and every week with the Mon Health system, and I hear this a lot, Jennifer, folks who have been with Mon Health system for 15 years, 20 years, 30 years, 40 years. You just go down the list, and that really kind of speaks to the environment and the type of a place it is to work when you've stuck around for 20-some years.
Yes, Mon's the best. Our culture, Mon truly is a family atmosphere. The practice of our providers who keep striving to do more than the competing services. Patient experience, even myself personally and even my family. We've also had many patient responses of the quality of the service that the team provides. They make them feel at home. There's not many places that you can go and receive the top performing services that Mon provides and still get the feeling of being the difference. And our nursing team helps, patients stay calm when, a lot of times you're going in and you have that anxiety. We have had such great response of just the feeling that the patients receive, not only from their